Go on, Skipper George.
Blackpot, Coco Show, man.
This is the Black Pot, aka Kukushonamo, where we speak truth to power. Panic as Lassa virus hits Ghana. Hey, we just had this health massacre. Oxygen short in Tamale Hospital. Bimbila Hospital, no power. Dead bodies are rotting up. Kolebu, hey, Mog. The fridges there are not chilling enough. Why? Why? Remember, we had coronavirus. From coronavirus, we had monkeypox. After monkeypox, now is Lassa fever virus. And look at what it looks like. Does this look like a joke? Even if you don't understand science, look at it. Doesn't it look like a demon? And this thing is in your blood. We all remember Ebola. Before Ebola was HIV/AIDS. Every damnable disease is from Africa. And we cry every day. Now, panic hits Ghana as Lassa fever is here. Look at this boy. When you get it, you will have blood from almost all your orifices. The doctors will tell you more. But if you look at this gentleman here, he doesn't look like somebody who is well. This is Lassa. It's a deadly virus. I am sure you want me to tell you more. Run the story. Watch it. Health alert. Lassa fever cases hit 14. One death recorded. Ghana Health Service cautions public to avoid contact with rats and mice. Come to this one. A total of 12 additional cases of Lassa fever has been confirmed, bringing the total number of cases in the country to 14. According to the Ghana Health Service, aside one death recorded, all 13 cases are alive in stable condition and are being managed in designated health facilities. A total of 97 contacts have been identified and efforts are underway to identify more contacts. A probable case has been reported from the central region and contacts are being identified and monitored while we await confirmation. Psychological support is being provided for all cases and contacts. A statement issued by the Director General of the GHS, Dr. PATRIOT said, in view of the recorded cases, the Ghana Health Service has cautioned the public to avoid contacts with rodents like rats and mice. Did you hear that? Avoid contact with rodents, rats, mice, kusie, akrantie. Don't touch them, don't eat them. In this country, we eat everything from grasshoppers to snakes and dogs, pigs, everything we eat them. Why? Everything you want to eat. What kind of a human being are you? You eat lizards, you eat snakes, you eat ants, you eat frogs, you eat worms, you eat even animal excreta. Akrantie, you eat excreta. Are you okay? Why? Why do you kill the animals? Don't you know that they love their lives too? Why is it that when you are running after the animal, is running away? I'm going to tell you more. Come back with the story. Now, this Lassa thing is very serious. Bring back the story. It says, and apart from running away from rodents and rats and akrantie and the rest, ensure good environmental hygiene and institute measures such as storing grains and other foodstuffs in rodent-proof containers, disposing of garbage far from the home, maintaining clean households, and keeping cats to prevent rodent infestation. Cats. Go to the Volta region, there's a shortage of cats. So rodents are having a field day. Go to the Upper East region, Bolga. There's a shortage of dogs. These are the animals that are supposed to catch the rodents. You have finished eating them. Members of the public are also to avoid contact with blood and body fluids while caring for sick persons. The Ghana Health Service wishes to remind the public of the need to report to the nearest health facility when unwell. We want to ensure the public that we will continue to work with our partners to ensure the safety of the entire population. The service assured. It will be recalled that in May last year, the GHS directed all healthcare facilities across the country to be on high alert for suspected cases of Lassa fever. It followed reports of cases in some West African countries, including Liberia, Togo, and Nigeria. The acute viral hemorrhagic fever caused by the Lassa virus is a zoonotic disease transmitted to humans through contact with food or household items contaminated with feces of rodents like rats, mites, etc. Lassa virus may also be spread between humans through direct contact with the blood, urine, feces, or other bodily fluids of a person affected with Lassa fever. Sexual transmission of Lassa virus may also occur. So right, you have sex and you, apart from having gonorrhea, syphilis, HIV, AIDS, you have Lassa fever. You just finish having sex and because you have Lassa, oh Jesus, having an incubation period of 2 to 21 days. The early symptoms of Lassa fever may include fever and general weakness. You'll be weak. Individuals may later present with headache, sore throat, muscle pain, chest pain, nausea, vomiting, diarrhea, cough, and abdominal pain. In some severe cases, there may be bleeding from the mouth, nose, vagina, and or stomach. Bleeding from the stomach. Vagina bleeding. Jesus have mercy. But they are also warning. They said death usually occurs within 14 days of onset in fatal cases. Early use of ribavirin within 7 days of disease onset. Supportive care with rehydration and symptomatic treatment improves survival. However, there is no effective vaccine for the disease at the moment. Dash it away. So, Bosu, this is where we are. Lassa, from one pandemic to the other, from one disease to the other. Please, let's eat healthy. During the corona days, the president told you to eat Kobe and momoni and eat a lot of dawa dawa. Please, don't only eat healthy when there's a pandemic. Eat healthy. Eat vegetables. Eat fruits. Don't eat flesh. Don't eat flesh. That way, we can save our planet and at the same time, save ourselves. If you love the planet, leave the animals alone.
Go on, skip a judge.
Blackpot, Coco Show.